Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. Nova Scotia is hurting, and it's devastating to have to talk about the recovery operation underway for 3-year-old Dylan Eller. To his family, it's hard to find the words. I can't imagine your pain. And I know you're scared. Hold on to each other and try to stay strong. And know that our thoughts and prayers are with you and Dylan. This continues to be a difficult time in our province and so emotional. The last 48 hours, we have lost 5 more of our most vulnerable residents due to COVID at Northwood. To their families, I'm very sorry. All Nova Scotians continue to hold Northwood residents and staff into their thoughts. Our health partners stand with Northwood as we continue to support them in their fight against COVID. And I know it's hard to hear about new cases every day, but you are helping to conquer COVID. Out of more than 800 tests, we had only one new case today. And in the last week, we had more than 100 people who have recovered. Some of them are seniors in our long-term care facilities. It's hard to get past the pain, but we have to push through it, stay together as we continue to flatten the curve. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I want to echo the Premier's comments. My condolences to Dylan's family, as well as to the families of the most recent of the residents most recently passed away at Northwood. We now have 46 Nova Scotians who have died due to COVID-19, and it highlights the ongoing serious nature of this virus. But I'm pleased to be able to report that, as the Premier said today, we only have, despite testing 840 individuals, we only have one new positive case, which is really good news. That brings the total number of confirmed cases in Nova Scotia to 1,008. We currently have 5 individuals in hospital. 2 of those are in the intensive care. We now have 722 Nova Scotians who have contracted COVID-19 but have now recovered. And we have 32,835 Nova Scotians who have been tested and have had negative results. Today we have 2 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. Northwood in Halifax, as everybody's aware of, has 156 residents and 38 staff with active cases of COVID-19. And at one other facility, we have 1 staff member with an active case of COVID-19. While it's good news that our case count is low, it is too early to relax. We need to continue to pay attention to COVID-19 and remain vigilant. And I do want to emphasize again that we still have a robust testing process. It's important that we anybody who may have symptoms that could be COVID-19, that we get them tested quickly, and if they are positive, do the appropriate follow-up. So any Nova Scotians who have 2 or more of fever, new or worsening cough, headache, sore throat, runny nose, if you're able to get online, do the 811 online assessment tool. If you can't, you can phone 811 and they'll walk you through a process to do further assessment and get direction as necessary for testing. It's important that people continue to understand that process. This Sunday's Mother's Day, which I want to bring this up for a few reasons. First, I want to wish an early happy Mother's Day to all the mothers out there, including my wife, who holds down my family fort in the last few weeks, and anybody else who's in mothering roles. I also want to give a big thank you to the mothers who may miss Mother's Day with their families and loved ones because they are responding to COVID-19 or providing other essential services. Thank you for doing that. And while Mother's Day should be a time when everyone can get together to celebrate, this Mother's Day, like other special occasions that we have right now, cannot be like it has in the past. So for those who are in the same household together, certainly celebrate Mother's Day as you always would. Give your mom a big hug, tell her you love her, make her breakfast. Thank her for everything she does. But for those of you who do not live with their mom, please, we need to find a way to tell your mom that you love her, thank her, either virtually or in person while respecting social distancing. It's difficult, I know, to do this. Particularly, many people have mothers in long-term care facilities who are otherwise away from their families and would love to be able to visit them. But it's important at this time that it's essential that we continue to take the appropriate steps that have allowed us to slow COVID-19 down, and we need to continue to protect those who are especially vulnerable, like people in long-term care facilities. I'd also like to pass along my sympathies to Nova Scotians who have recently lost a mother or a person who's in a mothering role from COVID-19 or any of the other recent tragic events. Along with Mother's Day, we have another weekend upon us. And I know many people will be looking to get outdoors. And I would encourage people that it's really important to get outdoors for our physical and mental health. But while we do that, it's important that we get outdoors and follow public health measures such as social distancing. So I would encourage everybody to go outside with those who are in your household for everybody's collective health. But make sure that as you're doing this, that there's at least 6 feet between you and other household groups. We're also asking people to not drive unnecessarily. Try to enjoy as much as you can what's in your community or neighborhood. And if you are out on trails, if you're passing people in a parking lot or in a park or on a trail, make sure you give each other the appropriate space. And if you happen to arrive at a park or a trailhead where there's a full parking lot, please understand that we need to limit the number of people at any one time and continue on and head somewhere else. It's important to also emphasize that the good personal hygiene measures that we need to continue to emphasize. Nova Scotians have certainly done a really good job in improving our practice on this. So we need to continue things like good frequent hand washing, coughing or sneezing into the crook of your elbow, sneeze in the sleeve, cough in the trough, we call it. Avoid touching your face because that's how we actually infect ourselves. And at home environments, regularly cleaning with a disinfectant cleaner, high-touch surfaces, counters, doorknobs, taps, things like that. People, it's also they can understand that if people choose that not wearing a non-medical mask when you're out in a public place, especially when it's difficult to maintain that 6 foot physical distance space, that if people choose to, they can certainly wearing a mask doesn't protect them, but it helps them prevent the spread if they happen to be an asymptomatic spreader with COVID-19 or any other viruses that we have in our nose and throat, helps minimize the chance of spreading those to other people. So we all need to continue with all these personal steps and also following the public health restrictions while we continue to move forward and plan for the future as reopening our province.
Thank you, Dr. Strang. There have been a number of media reports in the last few days about a document Dr. Strang presented to a group of representatives of business, associations, and unions. Some of the stories have suggested that Dr. Strang and I have been not transparent with you, our fellow Nova Scotians. Imagine, for the past 2 months, we have come here virtually every day to tell you everything that we know, the good news, the bad news, and the complications. We have said from the very beginning, we are all in this together, and nothing has changed. But some seem to want to make COVID political and discredit our chief medical officer, who is helping us get through this unprecedented time. It's one thing to come after me as an elected official, but it's entirely a different story to misrepresent what Dr. Strang was doing this week. We told all of you last Friday that Dr. Strang would be consulting with business and associations and sharing the new protocols with them and get their input about how we reopen our economy. The document he shared with them was based on national guidelines that are public. I did not see the document before his consultation, but we have had many discussions and we have all seen the national protocols. I am being as open, as transparent as I can be. To those who've suggested that Dr. Strang is keeping information from Nova Scotians, that could not be further from the truth. Today, Dr. Strang will walk you through that document, and there are no dates or timelines attached to this, And that's because we have not completed the consultation, and we have to monitor COVID. When the consultations are complete, we will come back to Nova Scotians with a plan as we phase in on how we open up our economy. But before I hand it back to Dr. Strang, I want to let parents, caregivers, and teachers know your children will not be returning to the classroom this school year. That's everyone from P to 9 and secondary students. At-home learning, though, will continue to June 5th, and that's when our school year will end. I want to thank teachers and parents in the Nova Scotia Teachers Union for their support as we continue to find our way through this unprecedented time of delivering education and as we work together on what school year will look like next year. Teachers will continue to work until the end of June to finalize assessments and report cards. So another workbook is on its way, and that means your kitchen is a classroom for a little bit longer. And I am hearing amazing reports about how well you are all doing. So hang in there. You only have a little bit longer. To the graduating class of 2020, this is a tough pill to swallow. This is not how you envisioned your grade 12 year. But there will be a way to celebrate, and you will come out of this stronger, smarter, and ready to take on any new challenge. To daycare operators, our goal is to have you reopen for June 8th. Dr. Strang will consult with you, as he does with everyone else, to help you understand the guidelines and protocols to reopen safely. A final decision will be made closer to June 8th. I've asked Minister Churchill and his team to work with daycare operators who are doing this during this transition. Now I'm going to turn it over to Dr. Strang, who will walk us through what he's been presenting in his consultation. But Dr. Strang, on behalf of myself and all Nova Scotians, I want to tell you how grateful I am for everything that you have been doing to protect our province and our families as we work through this unprecedented time as a province. And we will continue to work together and put Nova Scotians in the forefront of our actions and our thoughts.
Thank you very much, Premier. I very much appreciate that. So I'm going to walk through at the slide deck, which really outlines the national plan. It outlines the public health advice that needs to be considered as the government develops its plan for reopening the province. But it's important that people understand that no final decisions have been made on this at all. My role as Chief Medical Officer of Health is to provide the best public health advice to our elected government and also to Nova Scotians. Today's presentation, as the Premier said, is what I have been discussing with some stakeholder groups, and it will be what I will be presenting to many others through the next couple of weeks on the consultation process. It is not the Nova Scotia plan. It is a national framework for reopening developed by Canada's Chief Medical Officers of Health. It's public health advice to provinces and territories. And again, I need to emphasize, it is not the Nova Scotia plan to reopen. That eventual plan will be informed by public health, federal public health recommendations and guidelines, all of which are developed through discussion at the Chief Medical Officers of Health at the Special Advisory Committee that we all sit at. It'll also be informed by consultations with a variety of sectors, from business to nonprofits to community groups. It'll be informed by our ability to follow public health measures and advice to limit the spread of COVID-19, and ultimately by our local Nova Scotia public health epidemiology and other data. I thought it important to share people. This is our what we call an epidemic curve. So it's the cases by date of onset of their illness from the very beginning to where we are today. And so there's different colors there. Let me unpack this a little bit. So, and it's like other provinces and territories, it really occurs in 3 phases. So the initial cases in blue were ones that were related to travel, mostly outside of the country, and then some within other parts of Canada. The ones in the very light color there are the cases that are known close contacts of the first travel-related cases. And then the third piece is in the deeper yellow are then the long-term care cases. So we go from travel to close contacts to long-term care, and that at the very bottom in the dark color there, those are the cases which we conclude are from local community spread because they're not directly related to travel or a close contact or in a long-term care facility. The good news is, if you look at the far right of that slide, is that we are this is a typical epidemic curve. We are very much at the end of the first wave of COVID-19, which is good news, but we have to be careful. The wave is not finished yet. We have to wait for a minimum of 2 incubation periods, which from a public health perspective, that is what we should be waiting. Any disease, we wait for 2 incubation periods. For COVID-19, that is each incubation period is 14 days. So we have to wait for 28 days. We know, for instance, our neighbors in New Brunswick, they had no cases until in the middle of this week that we're just at the end of, and that case was occurred after 16 or 17 days of no cases. So we have to be very careful. Even though the curve looks good, we're on the right trajectory. It's still early on yet to make any make rapid and broad changes in reopening. So this next slide is what we can anticipate in the future. So the big peak is what we've gone through phase 1, and we're likely to see over the coming months these smaller increases and then decreases. Our goal as we reopen is to do it slowly and carefully so to minimize the risk of this happening, and actually that if we do see an increase, that it's a very small increase and we're able to control it carefully and quickly. And ultimately, it's not on this slide, but as we get into the fall and winter of 2020 and into 2021, everybody fully expects that in all likelihood we'll get a second wave, and we'll be better prepared for that wave than we were for the first wave based on the experience we've gone through. We don't know the timing of that wave, how big it'll be, how strong it'll be. Some of that depends on what happens in our recovery phase from wave 1. As we go through this, and so this is really a long. It's just because we're through wave 1, we have to understand that doesn't mean COVID is over. This is a many-month process as we go through peaks and valleys, and potentially a second wave, and maybe even a third wave. So it's public health people talk about a 12 to 18 month till we finally get enough immunity in the population that we stabilize around COVID-19. Throughout that period, there are a number of personal public health measures that we need to continue to all practice, and we'll be all. And this is the advice that we're giving as we go through all our consultation, as people all open up various sectors of business or society. We need to do that in a way that facilitates the continuing practice of these public health measures, and I'll walk through them very quickly. The first one is ensuring wherever possible maintaining that physical distance of at least 6 feet or 2 meters, because with COVID-19, if you're at least that much apart, the virus cannot spread from person to person. Continuing to practice, as I said earlier today, the good hygiene measures around hand washing, what we call cough etiquette, frequently cleaning. All of that decreases the ability of the virus to be transmitted between people. It's important that people stay informed and are prepared, and it continues to be important. A key role of my team that I'm very proud of is continuing to put out information to the public, continuing to work with a range of sectors to make sure they have the right information and in an understandable format, so to help support the practice of all these public health measures. So that flow of good information, and it will change in some areas as we get more evidence around COVID-19. So it's important to understand that just because we say something and then maybe a few months later we say something a little bit different, it doesn't mean we were wrong the first time. It means the evidence has evolved. we're going to have to continue to focus on being careful and limiting non-essential travel. It's the movement of people broadly that helps facilitate widespread of a virus like this. I've talked already about the importance of environmental cleaning and, where possible, increased ventilation in public spaces and work sites. We have done a lot about keeping people at home, working virtually, getting healthcare virtually. Some of those things that we need to continue for a long period of time that helps keep people apart, even while we reopen parts of our society. There is a place for using non-medical masks, as I said earlier. The evidence certainly doesn't support making those mandatory, but people in the public who choose to use a non-medical mask when they're out and about can certainly do so, especially in the areas where they're crowded, where they may be difficult to maintain that social distance. And in certain areas, certainly we know that wearing medical masks in the healthcare settings are critically important, along with other personal protective equipment. So I think it's important to understand that the rules around social distancing, enhanced hygiene, all those other pieces are here as are part of our new normal, certainly for many, many months. And I would suggest that they are become, in many ways, part of our new normal, because these things also help prevent the spread of other viruses like influenza, other foodborne illnesses, those kind of things. These measures help prevent those kind of diseases as well. We have to understand that a lot of this moving forward, the reopening, is about balance. We know that it was by necessity that we put very tight public health restrictions in place to deal with wave one. And that we continue to continue many of those, as I've just said, because one of our goals is about, while we are looking, if at all possible, to have no transmission of COVID-19, we have to respect that there may well be some modest transmission at a low level, and we're going to have to balance that, the need to minimize that, respecting that many of our public health restrictions have, while necessary, they certainly have and continue to have significant impacts on our health, on our society in many ways. Our ability to interact with each other is important as humans, and we've limited that, and ultimately our family, finances, and economy. So as we reopen up, we need to reopen up so we can address all those impacts and mitigate those impacts from the necessary public health restrictions. But we're going to have to do this in a careful, balanced way, balancing COVID versus non-COVID risks and benefits. And so that's why a lot of this, we say there are no firm timelines, no clear decisions at this point, because a lot of it depends on the ongoing work through the consultation, on discussions with various sectors, and also looking at our epidemiology that allows us working together to find the right balance as we work our way and things evolve in the weeks to months ahead. Part of what we're doing in public health at the national level, we've worked together, and this is, that what are we saying from public health that we should have in place to allow us to measure and monitor? Are we finding that right type of balance between COVID-19 and other impacts? So the things that we're working on in Nova Scotia, based on these 7 criteria from the Public Health Agency of Canada, we need to have measures that we're continue to look at. What is the epidemiology on COVID-19 telling us? What are the number of cases? Continue to have that epidemic curve, looking at that at a local level, and other clusters or outbreaks in certain communities that we need to be more aggressive on in terms of testing and response, like we have done through Wave 1. We need to make sure that we maintain some capacity in the healthcare system, that even if we're tolerant of some level of COVID-19 disease, we have to make sure that we don't one of the key objectives is that we make sure that the COVID-19 does not overwhelm our healthcare system. That continues to remain a very clear objective, and we've been successful of that so in Nova Scotia so far. But we continue to we need to have a level level of transmission that doesn't put us at risk of overwhelming our healthcare system. We also need to make sure that we have capacity in public health. So along with we have the capacity to continue to do the testing, the outbreak identification of cases and contacts, and managing outbreaks if necessary. We have to continue to protect high-risk populations like our long-term care facilities, folks in other collective living environments like our homeless shelters, and continue the plans we have in place in things like our correctional facilities, because those are the settings that if we allow COVID-19 to get in, we can spark a large cluster and an outbreak of cases, which could then spread back out into the community. We certainly have to be very careful as we do this that we continue to protect Nova Scotia and have controls at our borders, as well as working with our colleagues in the federal government, having controls at our international borders to minimize the chance of introducing or having COVID-19 brought back into Nova Scotia. And we need to continue to work with communities on awareness and engagement around all the things I've talked about, that there's a good buy-in and compliance, and people adopting all the necessary public health measures, depending where we are in the phase of our response. So the ability for us to move forward with the Nova Scotia recovery strategy will be driven by certainly looking at those indicators to help inform decisions made within government, and we're actively working at populating those indicators with the first set of data. It allows us then to do a risk assessment of where we are with the outbreak. We know that we have to be slow and careful on this, that, as I said earlier, that each phase you need ideally from a public health perspective to have that 28 days so you can say, well, whatever we did, we can monitor the impact before we take further steps. And as I can't emphasize enough that one of the key priorities here is to minimize community transmission, and so we can protect those very high vulnerable, high-risk populations, especially our long-term care facilities. We do have a regional variation on COVID-19 that certainly the health zones that are outside of Central Zone and HRM have had much less activity of COVID-19 and have a very limited activity in the last few weeks. But it's important that we address this from a provincial perspective. We're going to do things from a sector by sector basis, because if we do things differently in one region than another, we create a significant risk of the movement of people and goods will then just transmit the risk from a higher activity area to a lower activity area. So we're certainly going to be focused on this from a provincial response that is consistent across the province, but may look different as we go sector by sector. Just want to talk a little bit. So to do this, as I've said, we have the national public health framework, along with local, the epidemiology. We also are engaged in and have begun a robust consultation process for the range of stakeholders. Because what we're asking them is to understand, here's the objectives of our recovery strategy. Here are the public health parameters that we need to maintain in place, and then we're asking each of those sectors who know their own world and their own work best to develop a plan that they can bring back for further discussion with government about how they can open or remain open, but increase their access and service to Nova Scotians in a way that still protects public health and safety in the necessary and appropriate manner. So the initial consultation is giving all this information out to sectors. I have a very busy schedule the next couple of weeks, talking to a whole range of groups, and then working with them and the colleagues in multiple government departments to then have the plans be brought back in to be reviewed, and then they will be that along with the public health framework will be used by government to make decisions around timing and sequencing over the coming weeks and months. So this, I won't spend much time in this. This is a list of the various stakeholder groups. As I said, it's business, it's not-for-profit groups, it's community groups, it's the cultural sector, our sport and rec sector. If any groups look at this and they see that they're not on it, please connect with your usual way that you connect into your appropriate department, and we'll get you on the list, and we'll figure out how you can be fit into our stakeholder consultation. So we need to understand that as we assess all these plans and match them up with public health objectives, there's things we're looking at. That what is the feasibility of what we're doing? Is it meeting our objectives of finding that appropriate balance, minimizing the impact of COVID-19, especially protecting those who are most vulnerable to serious illness, protecting populations where there's high risks of outbreaks, but at the same time reducing many of the negative societal and financial impacts that have resulted. And we do need. I agree with the Premier that we need to re-stimulate economic activity, because ultimately a strong economy is also equals strong, healthy people and healthy communities, which is my lens that I always look at things. And lastly, we want to do things slowly and carefully. That while we may, as I said earlier, there may be some minor flare-ups and mini waves, we want to minimize the chance of those actively happening. Certainly in the consultations I've had so far, one of the strong messages from people has been, we'd much rather be tighter right now and keep what they call the pain for a little longer than run the risk of opening too early and then have to re-implement stronger measures. So slow and steady is going to be the way forward in Nova Scotia. There are other parts of the world, even other parts of Canada, who are going faster than we are, and we will learn from them. Maybe we'll learn a lesson that we could actually go a little faster, but they may actually learn a lesson from us about being slow and steady is actually where this is a long-term strategy that we have to have. And so I'm coming to the end. And so we're looking at, as we talk about what we're going to do in phase one, we're looking at a number of sectors. So on this slide, we need to look at businesses. Some businesses we have completely closed down, and that's a priority for us to allow those to reopen in some way. Many businesses have had limited their ability to function, or some have chosen to close down because of their ability to operate within the tight public health restrictions. So working with how we start to slowly open businesses up. We have schools and daycares they go hand in hand with opening up businesses, continuing to allow essential services to function. We need to make sure that we soon, and the Premier's talked about this, soon looking at how we open up childcare. We continue to look at, we've already made small steps, we continue to open up outdoor activity. This is an essential part of the life of our communities. It's critically important for our collective physical and mental health. We need to start to reopen up our healthcare system. Already working at plans to reopen some of the surgeries that we haven't been able to do, day surgeries, those kind of things in our hospitals, but also with underway beginning consultations with a range of healthcare providers who work in communities, whether it's family physicians, physiotherapists, massage therapists, there's a whole range, dentists, working with them how we get back to slowly a phased approach to getting people access to the healthcare that they're normally is available for them. We need to continue to look at essential cultural and societal events that can happen. We've certainly had the need for, unfortunately, the need for funerals and memorial services. We've had to be very restrictive on those, but those are the kind of things that how do we allow those to be a bit more permissive in those kind of areas, and ultimately looking at how do we start to allow social gatherings with a slowly increasing number of people that are available or allowed to be together. I think it's important that people understand that having mass gatherings, large numbers of people at a social event, large number of people at a cultural or a sport event, those are very high-risk situations, and have many of those type of events which really sparked a lot of transmission in wave one. And so opening up those big mass events is something that's going to be fairly towards the end of this process by necessity. I may have gone too far. So this is a diagram of the framing of the timing. No specific timeline there. We're at the beginning where we're doing the consultation, matching it up with the public health framework. Soon we'll be making some decisions on what phase one actually looks like. What we announced last weekend we call the pre-phase. It was a necessary opening up of some outdoor spaces, but the full phase one is coming soon, and then we'll continue this process of monitoring, looking at plans, working with stakeholders on how we can adjust plans, and then adapting our response plan based on the experience of what happened in the subsequent phase. So this will be a stepwise or a sequenced phase, step by step by step, done very slowly and carefully over the weeks and months ahead. So things will continue to look different, certainly as we move into the summer, but our objective is to move carefully and reopen things as much as possible, but doing so in a safe manner. And I continue to say that the normal, whenever we get to normal, is not going to be what normal was prior to COVID-19. It's going to be a new normal, and you've heard me talk before about how that new normal may be actually better. If we look at some of the things we've had to do to adapt to COVID-19, things like virtual care in the healthcare system. We've certainly had lots and lots of stories about how communities have stepped up and cared for each other. Those are two examples of that. What are the things that I would encourage us all to think about that actually has made life different but maybe better? And how do we carry those forward into the future to continue to make Nova Scotia, again, different but better as we move through the recovery phase and beyond? So that I'll end with by saying that this is, again, people are saying, what's going to happen when? What's the date is going to happen? There is no firm dates on this. We're going to have to ask people to be patient and be flexible as we move through this. But it's important that we move this through in a balanced and monitored way. And again, we have to be prepared that we could. There is the possibility of having to tighten things back up again. But one of our key objectives of moving slowly is to minimize the chance of that happening. And I'm done.
Thank you, Dr. Strang. We'll now take questions. Chrissy?
Just a reminder for reporters, you'll get one question and one follow-up in the time we have allotted for today. First question will go to CBC's Mike Gorman.
Thank you. Premier, I respectfully submit that reporters reporting on documents they receive doesn't equate to an attack on Dr. Strang's credibility. But I wonder, as I look at today's document that you have released, and I compare it with the one that was released from the presentation with the Chamber of Commerce, I do note several distinctions, and I'm wondering whether or not you would have released this document today and Dr. Strang would have made this presentation today had the document from Wednesday's presentation not been leaked.
We can respectfully disagree. So let's start at that point. I followed the news as well. This document was put together by Public Health. It was that it was out in the public. The basis of this thing has been put out by the federal government on Monday, and it was used to work with our partners. Quite frankly, it'll be our partners who will help us understand their business models and how we can best open up our economy safely and get them back to work as quickly as possible, ensuring that we're protecting public health.
Mike, do you have a follow-up?
Yeah, well, we aren't going to make any common ground on that one, Premier. I'm wondering if I could get your reaction to today's job numbers and what, if any, plans is your government looking at to try to accommodate what is obviously going to be a pretty painful period for a lot of workers?
Well, obviously, we're not surprised. I think you asked me this. One of you asked me this question when the job numbers came out early on, and I said I don't believe they are reflective of the reality. These job numbers were in the height of this, so I think they're more reflective of what's happening. It's why we're working diligently with our private sector partners to find a safe way to open up our economy that gets people back to work in a timely manner. If you look at the construction side of our economy, we continue to make those investments in construction work. We're pulling jobs up. You'll see tremendous numbers of tenders that have been out, not just in roads, but in public infrastructure that will help us come out of this recovery, not only for the few months after, but quite frankly, will leave us assets to build on in the years ahead. And we're working with our national partner to make sure that that the programs that are in place to support wage subsidies will continue to be there. I was pleased to hear the announcement today. They've extended one of those programs. We're hoping others will be extended beyond the end of June. And we, as a government, will look at, as we start opening up the economy, how can we best support those businesses with that startup position? Because there's a tremendous amount of cost associated with that they would have lost a lot of revenue. So how can we best support them as they hire our fellow Nova Scotians to keep employed?
Next question will go to Natasha Pace with CTV.
Thank you. Dr. Strang or Premier McNeil, I'm wondering if you could, I know you said there's no specific dates attached to this plan, but when we look at phase one, obviously it has a lot more detail than the other phases of the plan. Is it realistic to expect that phase one will start to be implemented sometime in the next month or so? Can you give us some idea of when you're looking at starting to allow more businesses and larger gatherings?
So we're working with the agencies that represent businesses and organizations across the province to get what that new normal looks like for them, and the epidemiology will determine the time frame. You know, last weekend we opened up some parts of our outdoor activity. We'll look at that today. We would have announced that schools actually won't go back in until next year, even though workbooks will still be sent home up until the 5th of June. We'll look at how do we open up childcare in our province as we start to see the economy open up to provide, ensure that our kids are in a safe, loving environment as parents go back to work. But all of that will be driven by the epidemiology, and that's one thing Dr. Strang has been very clear about. And it's why we need to continue to stay vigilant when it comes to following the public health protocols. But I can tell you, and we're working with our partners to put out what is the right framework for them to open up. You know, there's been lots of talk across the country about, people have laid out these plans. Governments have laid out plans without associations who represent businesses to know what the protocols are and how do they best operate. So we want to make sure that once we see the epidemiology go in the right direction, we want to make sure those businesses fully understand and are ready to hit the ground running at the time when we open it up.
Natasha, do you have a follow-up?
I do, thank you. I'm wondering, I don't know if you can really answer this because I guess you just said there's no timelines, but it looked like from looking at the document you just presented, the biggest question mark really is phase 5. Like, it seems like you're going to start slow, obviously, and gradually allow more and more gatherings and more businesses to open. But is like ultimately we're dependent on all businesses being up and running and our new normal operating when we have a vaccine available?
Go ahead.
So, phase 5 in the plan is really, and that national framework says, a vaccine. But I think what that really indicates, that final phase when we're whatever the new normal is, when we have developed a high enough level of immunity in the population, whether that's from having a vaccine or we've had enough experience and enough transmission over time of COVID-19 that we have a high enough number of people that are actually immune from actually getting the disease and being exposed. We're not sure about that. We're not even sure with this virus how long any immunity you get from being affected, how long that's going to be sustained. And there's a whole immunity task group that has been stood up nationally to look at these kind of questions. So really, phase 5 is really when we have a high enough level of herd immunity to minimize the transmission of this virus. That'll include whether it's all from disease transmission or what role a vaccine can contribute to that we don't know at this point in time.
Next question will go to Alicia Draus with Global.
Hi, Hi, I'm just wondering if you can speak a little bit more about what the thoughts are in regards to reopening the border, not necessarily internationally, but just with other provinces. Is there any indication in which phase that might fall in?
We'll work with the national government and our sister provinces across the country when it comes to opening up our border, but we're not there yet. I would say to you that will not be in the first phase if we go forward. We've been very clear that we're going to continue to move along this slowly, but I don't see the borders opening up. As a matter of fact, I hear some of my fellow premiers talking about actually restricting their borders even more. So that'll take time, but it will be in partnership really across the country with our partners.
Alicia, do you have a follow-up?
Yes, I'm just wondering if there's further information just in regards to where businesses fall in terms of whether they're considered to be low, medium, or high risk, and what phase they would be allowed to open. Are those is that future discussions, or do we already have some idea of what businesses are what?
So we look at certainly types of activity of businesses, but really the most important thing is what are the plans that they come back. Whether they're low, medium, or high risk, ultimately, I need to be able to be comfortable to say that they have a plan in place that provides enough level of safety, and to be able to give a recommendation to the Premier. And the type of things that need to be in place will vary between a low, medium, or high risk business. But if a high risk business came forward with a very robust plan, it doesn't mean necessarily that because they're high risk that they're going to have to wait at the end of the line, if you will.
Next question will go to Keith Doucette with the Canadian Press.
Yes, I'm wondering about the decision on daycares. You said it'll be reassessed at June 8th. I'm wondering why that is, given that you've just outright closed schools for the year, and likely if daycares go back, they will, like most of them, will be above the threshold that you'll likely have for public gatherings, which I presume would go to 10 people.
They'll obviously, that's what I'm talking about, is the reach out from public health to work with them to find out what are the right public health protocols that will allow them to open. As you know, they're all different sizes, different places. That will be determined what happens. They'll work with the Minister, Churchill, and his department on that sequence. And the reason we said on and about June 8th is because the epidemiology will determine whether or not we're going to continue to open up activity. And as you know, as we open up our economy, more and more Nova Scotians will be going back to work, and that means those families will require childcare.
Keith, do you have a follow-up?
Yeah, for Dr. Strang, I'm looking at the recommended gap between phases, presuming that this is something that you likely will implement, at least roughly, at being 28 days. It doesn't appear as if other provinces are having that much of a gap. New Brunswick, for instance, as you pointed out, some are going faster, some are going slower, but in New Brunswick at least, they're announcing phase 2 today, and that came exactly 2 weeks after phase 1. So I'm just wondering that how likely would it be that you'd stick to that kind of a framework once we get this thing up and rolling?
So that 28 days is the strongest public health advice, and I would say it has to be a minimum of 14 days, 1 incubation period. The best public health advice would be to wait for 2 incubation periods, but public health advice that needs to be weighed up with a number of other factors. So, and remembering again, this document with that number 28 in it is actually it's a national guidance document from public health.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. New Brunswick is opening up restrictions today, including small weddings, regulated health services like physio, museums, galleries, libraries. Our active case numbers continue to drop, and today just 1 new case was announced. Can you help Nova Scotians understand why we're in such a different position than our neighbors?
I mean, we're just, New Brunswick was fortunate not to have as much introduction of virus. We know the smaller provinces. One of the key factors is that you look at the COVID-19 tends to be more concentrated in larger urban areas. And HRM is by far the biggest urban center in the Atlantic provinces, and that's been where our concentration of activity is. We also have an international airport. The other maritime provinces provinces don't have that. So we have a number of factors that have contributed to Nova Scotia having more COVID-19 than our neighboring maritime and Atlantic provinces, but that's why that something like the national framework has to be applied jurisdiction by jurisdiction, because our epidemiology is different. I'm anxious to see what the impact in New Brunswick is on them opening up. That will give us information that will be helpful to us, frankly, here in Nova Scotia, to inform some of the steps when we're ready to take them.
Lindsay, do you have a follow-up?
Yes. In regards to the reopening presentation, what businesses fall under phase 5 who won't be able to fully reopen until there's a vaccine? And if this document is just a set of guidelines for a reopening plan, why is Nova Scotia the only province without a publicly released plan?
Well, I'll speak to the final part. I think, as I said to you in my previous question, there are many provinces who have released plans without details for the associations. So you have plans that are out there, for example, and denturists don't know how they're supposed to go to work, even though they're allowed to open. We've seen in some other provinces where other associations were caught off guard. I think the work that Dr. Strang is doing with our associations, it's amazing to me. I've been accused in the last 7 years of not consulting, and now we're being blamed because we're consulting, and we're allowing public health to use the best advice they can to ensure the safety of Nova Scotians. Business owners, organizations have told us they would rather go slow and steady and ensure our best chances of when we do reopening that we can stay open, as opposed to jumping ahead because we're trying to meet someone's expectation or trying to keep up with our sister provinces. We were the last province to get COVID. It stands to reason. We would be one of the last provinces to open. We've all taken different approaches about how we deal with this issue and how we bring our economy forward. And I, for one, believe that the cooperation between public health and the associations representing our economy is a good step so that when we actually do open, we'll be ready to start from day one, as opposed to having people look and wonder what the rules are and what they would have to do in their business. And I think it's important as we go through all of these steps. Certain businesses will open at different times, but we'll never get back to where we were for quite a while. When these large gatherings are just not going to happen. Businesses are going to have to adapt to the new public health model. When you look at the vaccine at that time, which is step 5, you will start to see some of that change. As will so when we understand some of the information that we're receiving changes, we'll adapt the rules around public health to that. But Nova Scotians have been loud and clear about this. They want us to follow the advice of public health. Public health has been very cooperative, working with our sectorial partners to ensure that businesses know what's available as we go forward. And we're staying committed to working with Nova Scotians and doing this in a timely, thoughtful way that protects our economy but also protects the health of Nova Scotians.
Next question will go to Olivier Lefebvre with Radio Canada.
Oui, merci. Premier, looking at those different phases permitting non-essential businesses to reopen, referring to that national protocol, we understand they won't reopen all at the same time. So I was wondering if you have thought of any additional dispositive to help financially those who won't be the first to reopen.
Well, the documents and the support that they bring to public health after they understand the full public health protocol will determine when they open. Dr. Strang just said in an answer a few minutes ago that if there's a robust plan about protecting public health, we'll look at opening those economies up. It won't be a phase. It will be based on how the association has been able to work with public health to protect their customers. We're going to continue to look at that. I have said we will look at, is there a way, particularly for the startup costs associated with some of our businesses. We're focused on those that have been closed by the order. But let's be fair and frank about this. There were other businesses that have closed simply because we told people to stay home, and we took away their customer base. So we have to be mindful and thoughtful as we put together a program that capitalizes on the federal dollars that are out there, when it comes to the economy now, and use our precious public dollars to help fill in and begin that startup of those businesses.
Olivier, do you have a follow-up?
Yes. Again, for the Premier, you talked in previous briefings about how people who stock grocery store shelves, cashiers, people who deliver stuff, are all doing essential work, but you excluded them from getting the essential worker top-up. The PEI government has included these mostly low-wage workers in the program. So why did you exclude them from the Nova Scotian program?
Well, first of all, I want to thank all of those who have been working and continue to work throughout the economy of our province to move it forward, from cashiers in grocery stores to the construction sites across the province, continue to make sure that our economy is moving, whether it's in the fish plants or in the agricultural sector across Nova Scotia. When the first program came out that the national government spoke about, it excluded healthcare workers who were on the forefront, who are doing face-to-face, hand-to-hand treatment of facilities, ones who come in direct contact with COVID. It was unacceptable for me. We wanted flexibility from the national government to ensure that our frontline healthcare workers who don't have 6 feet of separation, don't have plexiglass between them, have to deal directly hand-to-hand or go into people's houses to deal directly with this virus. I'm proud of the fact that we have people working to try to keep our economy together, and I want to thank them for that. And those businesses who have been working and supporting their employees, I want to thank them for that. But I also wanted to make sure that we as a province recognized our healthcare workers who are on the front lines doing a hand-to-hand work, who were the ones who came in contact with this virus, were also going to get the benefit, and that's why we continue to fight for that arrangement. While others suggested we shouldn't, we fought for that arrangement because we believe it's important to give the bonus to those who are directly impacted by COVID on a personal level.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Premier. I have a question about transparency, I guess. My understanding, I'm told by several people that Deputy Minister Bernie Miller is in charge of what's labeled a recovery committee that meets every other week. I'm told there's no union representation on it, no one from the nonprofit sector, but there are people from the private sector. So can you tell us who's on that committee and how they were selected?
Sure. Bernie is the Deputy Minister of Business, along with my colleague, Minister McClellan, have been working with organizations across the region. So the organization that Dr. Strang presented to actually has union representation on it, as it has the Chamber of Commerce on it. It's a wide-ranging group of individuals. He was speaking with them every week. He continues to speak with CFIB, who represents small businesses across the province. We, as different departments within inside of government, Minister Reagan's working with not-for-profits through community services. We continue to see those things flourish. I mentioned in my remarks about public education. Again, appreciate the cooperation from the Nova Scotia Teachers Union with the Minister of Education when it came to dealing with our public education system. I see the Nova Scotia Nurses Union today talking about PPE and wanting to have a conversation about that when we come through, but I want to thank them for their continued collaboration and recommendations as we've been working our way through this. So suggest that anyone has not been part of this conversation is just not factual. The Deputy Minister has been working along with the Minister, talking to all of our partners in the economy of Nova Scotia.
Tim, do you have a follow-up?
I do. I don't think you answered my question. I didn't ask who the committee was talking with. I asked you who was on the committee and how the members were selected because, again, I'm told that there are people from the private sector on the committee, not talking with the committee, but on the committee, and that there's no union representation on it. Can you address that question, please?
It's just not factual. It's wrong. I said to you, the minister, with the deputy minister, has been, along with the minister, reaching out to all kinds of organizations. I don't know what committee you're referring to. The Chamber of Commerce and the associations and union leaders have put a committee together outside of government that we've worked with. This is the kind of stuff that I find remarkable. Looking for something that we haven't been transparent, we've laid it all out in front of you. The fact that we've gone out and communicated and tried to collaborate with people out in the field now is somehow a weakness of government. Everything we've done has been here in front of you every day. So I appreciate the question, but we're going to continue to work as all across government with all of our partners representing everyone in Nova Scotia. We've started this journey together, and we're going to end this journey together. No matter how frequently people might want to try to divide or look for some reason to find some level of whatever they think is conspiring behind the scenes, fact of the matter is we've been open and transparent, and I want to thank those Nova Scotians who are staying focused on the goal, which is ensuring we try to get back to some level of normalcy.
Next question will go to Daryl Cole with Amherst News.
Hello, Mr. Premier. On several occasions, I know you've said the border for New Brunswick is not closed to traffic, but is restricted to those who need to be here, and that those entering must self-isolate for 14 days. I'm hearing concerns from the Nova Scotia Government Employees Union that the conservation officers staffing the border have no enforcement capabilities and can't turn anyone away. The question I have is, why is that, and when will they be given enforcement capabilities?
Well, if we were going to turn people away, we would call law enforcement. That would be the reality. What we have are people providing information, making sure Nova Scotians who come home know that they have to self-isolate for 14 days, knowing people who come in, they're allowed to come in for essential service work. They can come in and they need to go home that day. There are people doing that. That's what was happening. The bigger issue here was Nova Scotians who were coming home and not self-isolating. And we wanted to make sure we had at our entry points that information, those picket lines. If we felt that there needed to be the authority to enforce a higher law, we would actually appropriate agency who would enforce that.
Daryl, do you have a follow-up?
Yes, I know I've spoken to the Amherst Police Department on several occasions, and they're receiving calls from people in the area about out-of-province vehicles at various locations in Amherst. If the border's not closed, is there a better way to enforce the restrictions rather than passing it on to municipal police or RCMP?
Well, there are people coming back and forth. I don't want you to leave. There's workers who are coming who live in New Brunswick who come to Nova Scotia. As you know, in Spring Hill, there would be a lot of people working in the federal penitentiary who live in and around the Moncton area. There are people who are coming to work in the economy in the Amherst area who hasn't been closed, which is the manufacturing sector. So some of them would come across the border, and then they would be returning that day. So that's part of keeping our economy moving. The sectors that we haven't closed down, what the people on the border are doing is providing information for those who aren't coming in. Either they're not Nova Scotians or they're not coming in to go to work. Here are the rules you have to follow, and you need to identify where you're headed and how you're going to self-isolate.
Next question will go to Kyle Shaw with the Coast.
For the Premier, Halifax, we're seeing in Halifax Regional Municipality and other municipalities across the country laying people off and doing hiring freezes because of COVID-19. Are any provincial staff being laid off or hiring freezes being put in place?
No, there have been no layoffs. There's been an adjustment in seasonal hires. They may move depending on what opens and when it opens. We'll continue to monitor that, but departments are not replacing people at the rate they were. But no, we are not thinking about laying off anyone.
Kyle, do you have a follow-up?
Yeah, it's for Dr. Strang about statistics. This week there was a change to the way cases in long-term care facilities are reported by the province. So instead of the cumulative number of cases in nursing homes, you're just reporting the number of the current active cases only. And that seems like a good change to help the public understand the current situation. So can you do the same thing across the 4 health zones to show the number of active cases now currently happening across the province instead of showing the total number of cases in history?
Yeah, we're looking at that, and we just have to make sure we're careful. And some of the numbers in some of the zones will be very low, so we're looking at. We expect to do that, in the next week.
Next question will go to Bill Martin with 6 Rivers News.
Question for Dr. Strang. I appreciate you've already addressed the idea that with the vast difference in numbers from the central zone to the other healthcare zones, that the epidemiology suggests that the problem, of course, is in central. You've also said throughout this piece that you will react to the evidence of the epidemiology. Wouldn't that suggest that you could, in fact, relax some measures in the other zones prior to taking those actions in the central zone?
I think the very real risk if we did that is that you then have people moving, if you relax, for instance, shopping or other things, then you actually, what you may facilitate is people moving from an area where there's a higher risk of transmission and bringing the virus with them. Our preference remains and certainly in discussion with government is that we need to have a sectoral approach here, that we're much better to open up sector by sector, work with them and have appropriate plans across the province, and not create differences within the province that may facilitate movement of the virus and actually increase the risk of spread.
Bill, do you have a follow-up?
Thank you, no.
That's all the time we have today for questions.
Thank you, Chrissy. Today, many Nova Scotians would have gathered to mark the 75th anniversary of VE Day, when Nova Scotians and our fellow Canadians played an important role in the Allied efforts to liberate Europe and to end the Second World War. Today, we pay tribute to those brave servicemen and women, thousands of whom paid the ultimate sacrifice. We can't gather this year, but we can take a moment to remember. And I was honored to lay a wreath today on behalf of all Nova Scotians. There's another group that we will honor this weekend. They are also brave and strong. On Sunday, we will celebrate Mother's Day and all those who fill the role of mother. Sadly, because of COVID, we can't hug our moms this Mother's Day. Many of you know how much my mother meant to me and the rock she was that we all stood on. We as a family lost her 11 years ago, but she still is in my heart and she still guides me every day. For those of you who are still fortunate enough to have your mother, you need to be creative in how you celebrate them from a distance. I wish I could hug mine again, and I know most of you wish you could hug yours this weekend too. But let's in turn that hug into words. Tell your mother how much you love her. Tell her how much you miss her and how important she is to you. Our mothers, those who take on the role, are among the most important people in our lives. They help shape us, they help show us the way, and they give us strength. Let's honor them this weekend by staying strong and staying in touch the best way we know how.